What is Parkinson's dysphagia and how can you manage it? Imagine trying to swallow food or liquids, and suddenly it feels like the muscles in your mouth or throat aren't cooperating. That's what happens with Parkinson's dysphagia, a common issue for many people living with Parkinson's disease. Parkinson's disease is a progressive neurological disorder that affects movement, and it can also impact how you swallow. This happens because the disease affects the brain areas responsible for controlling the muscles involved in swallowing, including those in the mouth, throat, and esophagus. The difficulty can range from mild to severe and can lead to serious health problems if not managed properly. Swallowing is a complex process that involves a series of coordinated muscle movements starting in the mouth, passing through the throat, and into the esophagus. In Parkinson's disease, muscle rigidity, slowness of movement, and loss of motor control make these muscles less effective. This can cause problems like difficulty starting a swallow, repetitive tongue movements often called tongue pumping, leftover food in the mouth after swallowing, coughing or choking during meals, and the sensation of food getting stuck in the throat. Drooling is also common because saliva control becomes impaired. One of the most concerning risks is aspiration, where food or liquids accidentally enter the airway, which can lead to pneumonia. Dysphagia can develop at any stage of Parkinson's but tends to worsen as the disease progresses. It is linked to both motor symptoms, like muscle stiffness and slow movement, and non-motor symptoms, such as issues with coordination in the brain. Recognizing these signs early is important because managing swallowing difficulties can help prevent complications and improve quality of life. Managing Parkinson's dysphagia involves a team approach. The first step is getting an assessment from a speech-language pathologist or swallowing specialist. They can perform tests to identify specific problems and develop a personalized plan. Swallowing therapy is often recommended, including exercises to strengthen and coordinate the muscles involved in swallowing. Techniques like changing your posture during meals, such as tucking your chin to protect the airway, and controlling the pace of eating can make a big difference. Diet modifications are also key. Adjusting the texture of foods and liquids can reduce choking risks. For example, thickening liquids or choosing softer foods can help. Eating smaller, more frequent meals can prevent fatigue and make swallowing easier. Avoiding dry, crumbly, or sticky foods that are harder to swallow is also advised. Medications for Parkinson's disease can sometimes improve muscle control and swallowing ability. Timing medications around meal times might help enhance swallowing function. Good oral hygiene is essential to reduce the risk of infections from food residue or saliva pooling in the mouth. Regular dental checkups support overall oral health. Monitoring for signs of aspiration pneumonia, such as coughing during meals, fever, or respiratory infections, is vital. In some cases, if swallowing becomes too difficult or dangerous, healthcare providers may recommend alternative feeding methods like feeding tubes to ensure proper nutrition and prevent choking. Education and support are also important. Learning safe swallowing techniques and creating a calm and hurried eating environment can help reduce stress and the risk of choking. Encouraging patience and mindfulness during meals can make a significant difference. In summary, Parkinson's dysphagia is a swallowing disorder caused by muscle control issues related to Parkinson's disease. It can affect chewing, moving food in the mouth, and swallowing safely, which may lead to serious health risks. Managing it involves a multidisciplinary team, including healthcare professionals, swallowing therapy, dietary adjustments, medication management, and vigilant monitoring. Early recognition and intervention are essential to maintaining safety and a good quality of life. If you or a loved one experience swallowing difficulties, it is always best to consult with healthcare providers to develop a safe and effective plan tailored to individual needs.